You're right on time, John. It's 1:30 this second.
Oh, I'm glad to hear that.
No, it's.
You're up.
You're just trying to.
All right, we are on the record.
1:31. I
The
just.
commissioners are back in session, and Pocatello Free Clinic,
Yes.
budget talk.
Okay. Well, we handed you guys a sheet that I emailed it to Christine, and she said she had shared it with you. And I'll introduce myself. I think I know Commissioner Prouder from the integration meetings, and it's Jason, right?
Yep.
Jason, I remember you from years past. But I'm Sherry Joseph. I'm the executive director of the Free Clinic. I've been in that position in an unpaid, starting as an unpaid volunteer in 2019, and then in the position formally in 2020. In the past year, we have added Amelia Carrillo, and Amelia is coordinating our outreach efforts, and that's kind of what we wanted to focus on talking to you guys about today, because it's something that we added on that we're very proud of. And she's a U of I graduate and an American Falls native, and we're very lucky to have Miss Amelia on board. And then I have Dr. Georgia Milan, who's been with us since 2019 as well. She's our medical director, and again, very lucky to have an MD that is willing to work for us at a reduced rate to make it all happen. And so Amelia pulled these statistics together for us to share with you, and the main takeaways really are the increase in what we're showing already here to date in 2023, and that's largely due to being able to have the funds to hire someone like Amelia who can really focus our outreach efforts. And I'll let her speak about that a little bit, what we're doing here locally.
Yeah, sure. So in this first graph, you can see that even in our first quarter, our efforts have doubled, if not nearly tripled. We strongly believe in meeting the individuals where they are. So my outreach efforts in Pocatello, we do just that. We go to the food bank, which is Valley Mission here. Aid for Friends is a homeless shelter, Salvation Army. And then we also have seen a huge uptick in the people that we see at new events. So we go to the ISU Health Fair. We did the Community Health Fair with United Way. We will be at Juneteenth and the Pride events this summer as well. And we offer general screening. So like I said previously, our main goal is to meet these individuals where they are and where they are already gathering. Something that is unique about our clinic is that we can offer social services. So a lot of these individuals that we see, they already have so many burdens that they are trying to overcome. And so when we meet them, we always try to bring a social worker. And so that social worker can help them relieve some of those burdens. So if they're housing insecure, food insecure, if they aren't on Medicaid, we assist them directly through each steps of either signing up for Medicaid or getting a housing application in. So not only are we there for them medically, we are there for them holistically. We believe in serving them, well, really just alleviating any burdens that they may be facing.
It helps our local community members, and it's more than just their medical needs, which of course are important, and decreases the burden on the county, on the city, on the hospital. But you may not be aware that we are trying to get anybody on Medicaid that we can, and through, every dollar that is given to me, that you guys give to me and everyone else gives to me, I try to stretch as far as I possibly can. I mean, that's my goal. So we have hired 2 part-time social workers, but we're using the social work students from ISU, and so they're coming to us for free. And so again, stretching those dollars, but I need a supervisor to be able to have that, so I've hired someone that can supervise them. But they're having individual meetings with our patients, and they may say, I tried to get housing, I don't know how to do it, I'm homeless, or I'm on the wait list at the shelter, or I'm living in the park. And so we've facilitated helping people not only get housing, but access to food. We've started that food bank, as you guys know, in our small building, so everybody can leave with a bag of food, plus of course sending them to places where they can get boxes of food. The mental health burden is something that I really wanted to speak about. And as you see, our top 3, mental health is one of our top 3 diagnoses for patients that we see. But by adding the social worker, we've also added a graduate social worker, and one of our social work employees are providing one-on-one mental health counseling. And as you know, I just pulled that I just pulled the statistic. 70% of all Idaho communities do not have enough mental health providers to serve residents, and that's a 2021 statistic. And suicide is the second leading cause of death in Idaho for ages 10 to 44. Depending on what statistic you look at, we're anywhere from 5th to 8th in the nation for suicide, and Bannock County has, in tradition, I couldn't find recent Bannock County numbers, but traditionally we've led that rate, and it's not a good place to be. I also think about our work with the Crisis Center and how we facilitate the medical care of the Crisis Center, and I know Commissioner Moser remembers that we were brought in to that to facilitate that. But trying to reduce the mental health burden among community members, I take as a very serious effort, and it increases the health of our whole community by addressing this, and hopefully decreases the risk to our community by working with the policemen, by working with the Crisis Center. It's someone who is, lots of times, who is very mentally challenged without having access to proper care, who does something in a community that is, is risky and unhealthy. Georgia has many stories about patients that we see, and they tell us all the time, we don't know what we would do if you weren't here. But again, we are trying to get anybody that we think qualifies for Medicaid on Medicaid. Sometimes those appointments are an hour, and because I have the students and the funding to be able to help with that, we can facilitate that. They'll be like, I didn't know where to go, or I didn't know how to do the paperwork, or I didn't understand it. So anybody that we can get over to Health West and part of that system, we do that. But there is still a gap, and I know you guys are aware of that also.
Right, and we take care of so many people. They don't have to be just like destitute, the homeless, on the street, but so many people who just don't have insurance.
50% of our patients are employed. And,
yeah, they're employed, but they don't have insurance. And there's a lot of employers who won't give insurance for that first year. And that's the problem, is that, we'll see people who are so far gone by the time they see us that we can't turn them around. And we've had people die within 6 months of finally getting in to see us, and they say, well, we just didn't know you were here sooner. And the whole thing is we're trying to, prevent those bad illnesses, get people healthy and happy and on that road. And some people hate to get on Medicaid because that means they have to leave us. And they know that they can trust us, that we really care about their hopes and dreams. We really care about their lives. We care about the harmony and the happiness in their family and in their future.
And trying to get them back into the work, for some of our patients, back into the working environment. We're successful in that, but it takes the time to spend with that patient to get them healthy so that they can start working again. Fixing their teeth. If you can see our dental numbers there, we've had patients be able to go back to work because their teeth were fixed. We're going to start doing dentures. Nobody in the community can get dentures at a reduced cost. And that's something that we're going to be starting in the fall due to some grant funding. And it's not only for older people, it's also for somebody who has maybe had a history of drug abuse, where they've lost teeth due to drug abuse, and then no one wants to hire them. And so that's something that we're working on as well.
And we assist people who just kind of fall on hard times. At Valley Mission, at the food pantry, I had a client come in, and her husband just lost his job, and through his job they had insurance, and at that time they were both very sick and they were needing assistance, and it was almost, just very gratifying in the fact that we could help them. And she was almost embarrassed coming to us because never before in her life had she had to reach out for resources. But just individuals that fall on hard times, we are there for them and able to assist them until they are back on their feet. So there are gaps, and we are the entity that fills those gaps.
I have a PA who started for us. She was a volunteer for 2 years, and now she's working for us 1 day a week. And she had a young man the other day who had, I don't know if you guys, I'm sure you're aware they're doing Medicaid, they're kicking people off because it was expanded for COVID and that has expired. And so this young man had Medicaid and was able to afford his medicines through Medicaid, but now he's been kicked off and he can't afford the asthma medication, the things that allow you to be able to continue to work. So that's what we're doing. So all medicines are free, all labs are free, all counseling is free, and the tie with the university just keeps growing. We use probably students from 8 different departments there, from athletic training, who act like physical therapists, to the dental hygiene students who clean teeth, to the family medicine residents, the dental residents who pull teeth, fill teeth, the social work students, the pharmacy students, the PA students, and that to me is a huge win for this community. So. And then we still have the tie with Woodport. I wanted to make sure to mention that. Our funding with Bannock County, we're very proud of. I think it sets a role model for how a county can support a clinic. It has been at $60,000 since 2018. And as you do know, things do cost more. It'd be nice to have a little cost of living increase. If that was possible, we'd be very grateful. We are boosting our ask from the city of Pocatello, and I have the mayor's support in doing that. We go before them on June 15th, and we're hoping to get $25,000 from the city of Pocatello this year, which would be a large increase. And then we also get $7,000 from the city of Chubbuck.
So 60,000 is where you're at right now. And what's your ask this year?
I'd like 10% more.
You know, and one thing to keep in mind, because it's so amazing, is that we have had our doors open for 52 years. We are the longest open free clinic in the United States here in Pocatello, Idaho. And that's not because of the worker bees, of course, that you need them, but it's because of people like you. It's because of the community that has really emphasized health for everyone, that the health of the community is based on the health of every individual in it. And so it seems like that's such a gold star for Pocatello, Idaho, because I've worked at other free clinics. They're not near as good as this one. It's been open for 52 years. I mean, that's something you all should be bragging about when you meet with other county commissioners.
Idaho Falls doesn't even have one. They keep saying they're going to start one, and he's been saying that for 2 years, the gentleman there, and I think he's just sputtering to get going. And here we are, just chugging away.
But for 52 years, I mean, that is
and the growth,
amazing.
The growth since 2019 has been dramatic. I'd be happy to share that with you at some point, but what we're able to do and what we're able to accomplish through using the university and stretching every dollar, it's a big deal. And having the crisis center. I can't thank you enough for the foresight of having that crisis center.
It's huge.
Right, my office is right on that parking lot, and I watch the police pull up there and drop people off. And think about, before that, they went to the ER, they went to the hospital where they don't belong.
Or to jail.
Yeah.
Mm-hmm.
Yeah, I forgot to jail.
Exactly.
That's what I meant to say.
Exactly.
They had nowhere to take them, basically, and that's such a gift to this community also. So.
And one other thing, even though if you've been in our clinic, it's pretty small and we use every little square inch multiple times, but we also house other providers. For example, Dr. Esplin, who's an orthopedic specialist, who has retired. He has a clinic that's free to anyone in the community, and
he volunteers.
We house that. He volunteers. We provide the staff. We have 2 fourth-year psychiatric residents coming from the University of Utah. And it's kind of like, yep, we're going to make room for you, because they can take care of our community without you all having to pay for any of that.
And there was a cost associated with that. Each resident the cost was approximately $12,000, and that was a lot for us. And the Rotary went to bat for us, and they're raising the money, and also through the Idaho Community Foundation. They are paying for that resident to come. And the university was so excited, they're giving us 2 residents for the price of 1. So that's just an example of how you, so.
Joan, questions? Comments?
What is your coverage area?
Anybody, as long as, and
Geographically,
who we actually see or who we will see.
where do you have like a bus or something that you?
No, we have a van, but we use that to go to places for outreach. But and we also have free rides now. So if somebody does,
I'm sorry, you have what?
Free rides.
Okay.
So through a grant through United Way, if somebody does live in an outlying county and they'd like to come see us, we have an ability to get them there and get them back through a car through United Way. Most of our biggest number of patients, of course, is Bannock County. The next highest number would be Power County. We do see Bonneville and Bingham, and some from the neighboring southern counties. I think with the southern counties, transportation is more of an issue, and we need to get the word out there more about the shuttle system. It just started about 3 months ago.
Are most of your clients in Pocatello?
Yes.
Okay. Do you know what percentage?
Off the top of my head, 75% maybe, and I'm guessing, but it's something like that.
That would make sense.
Okay, thank you.
Okay.
Anything else? Well, I'll just tell you, as we look at the budget, we're just getting started in here. We are not looking to increase. Just like you said, price increases go to everybody in every department. We have a lot of departments. But we're not looking to decrease from what we've done last year. That's not a promise.
Okay.
That's, as we get started into the budget, we look at line by line, and
Make it balanced.
there's a
I
lot there to
understand.
look at.
Yeah, it's got a balance, and I totally get that. So, but everything does cost more, and I know you understand that.
Oh,
So,
And we really appreciate your support, and we
Yes.
do make your dollars go a very long way, and a lot of people benefit, and so we're just very grateful. Thank you again.
all right.
thanks
Well,
for the
thank you.
time. We
Yeah.
really
Thank you.
enjoyed coming in to tell you about what we're doing, so thanks.
We appreciate it. We appreciate all the work. Thank you.
Mr. Moser.
And the free clinic's the best.
My friend.
What, you already started in your time?
Oh, BJ, the clock's ticking.
We still need to talk, we do need to
It's
talk.
ticking, right?
Oh, no.
Tight
Well,
ship.
we will
Tight
get
ship.
together. Okay.
His purse or something on this chair?
Oh, Amelia,
Oh.
that Moser guy runs a tight ship, you gotta watch him.
Hello.
Hello.
Hey there.
How are you guys today? Doing
Love and
well?
life.
All right. I sent some things over. I don't know if you got them all. And then I also have, and I'm not good at this. I'm the worst PowerPoint person. Do you want to see a PowerPoint, or do you want me to just chat?
Just talk to us.
Oh, sweet.
We
Okay.
don't have the computer. We don't have our people here to run it.
I'm sorry. We could try. We could struggle through it. But I'd much rather just talk to you guys and tell you what's going on with Aid for Friends. I do have something to hand out along with this annual report that I gave to Christy, which I think is helpful because it describes the different programs. It gives a definition or a description of them.
Okay, let me have you introduce yourself and who
Would
you
you-
represent for the record, please.
Thank you very much. Good afternoon, Commissioners. My name is BJ Stensland. I'm the Executive Director at Aid for Friends. And hello, Jason.
Hey.
So, yes, that would be nice for the record to let you know who's chatting up here. One of the things I would like to give you, and we won't go through it, but we hand these out. It's descriptions of the different programs that Aid for Friends offers.
Okay.
And it's nice, if you're curious what the statistic is, here's the description. I just need one in case I'm, thank you. How much time do I have?
15 minutes.
Okay.
You're 5 minutes in.
All right. Aid for Friends has been around since 1984, so that's almost 40 years. And we have continuously provided services to the community. Last year, we served 1,848 people in southeast Idaho and Bannock County. That's our total of all of our programs. For our shelter, there was almost 400 people. And you think about that, how many lives were impacted by being able to have safe, secure lodging. It's huge. But I also wanted you to be aware that there's other programs. Aid for Friends is primarily familiar, or most people know, if they know anything about us, is that we're a shelter. Our Our new shelter has been up and running now for a year and a half, and it is doing really, really well.
Are you 100% open now?
We're not. At this point, we're still treating it as congregate living, and so we're keeping that 6-foot separation. We're
And why?
averaging about 40 to 45 people.
Why are you still
There's a
operating?
couple of reasons.
Yeah.
One is we don't have the staffing
Okay.
for case management to meet 100%. And the other thing is there's still COVID out there and congregate living. I want to be guided by Dr. Mylan and the Southeast Idaho Public Health on the best way to make sure everyone's safe. We've designated a certain section of the shelter for quarantine, and we're one of the few shelters through COVID that didn't have to shut down or encapsulate itself and keep people in or not let people out in this region. That includes Boise and Salt Lake. So by being cautious, we kept people safe, and we were able to ensure that people weren't making others sick. So those are the things I want some guidance on. I'm meeting with ISU to work on some internships so we can get some help with case management, because our case manager right now is at capacity. So we want to provide the services we need to provide.
Well, I'll just tell you that Commissioner Moser,
Okay,
that case management and not having staff is a good reason. COVID's over.
well, yeah.
I'm just saying, that's where this board, I feel.
Okay, and I appreciate that, but I also know what it's like in assisted livings and nursing homes. While they've loosened the regulations, I think they're still cautious. And the last thing I want to do is get 40 people sick and try to put them through the emergency room. So we are cautious. And it's not just COVID. There's other things that are keeping us from
I
being at full
sit on that
capacity.
health board too, so.
Okay, so you know about it. And again, just being, I'm not a medical professional, but I sure appreciate the people that are. And to be able to have their guidance, I think saved us. It was wonderful partnership.
The
Okay,
guidelines have come through and said it's over.
I appreciate that. But congregate living is still an issue. That many people close together is scary. Okay, so we have the emergency shelter. We had a utilization rate last year of 65% capacity. In '21, it was 72%. And the reason it was higher in 2021 is because we started in July. So that number was higher. We let people stay up to 90 days, and then they have to be away from the shelter for 90 days before they can come back. And that is now, it can be spread out in various ways. And the average stay has been 24 or 27 days. So most people stay less than a month. Our biggest challenge.
Can I stop you there?
Sure.
Why?
Why what?
Why are you're allowed 90 days, why are most people leaving in 27 days?
A variety of reasons.
What are some of the main reasons?
Some don't comply with rules. Some find other accommodations, either temporary or they are fortunate to get housing. There's just the full gamut of reasons that people stay an average of 27 days. This is the other thing. That's an average. So we have some that stay 1 or 2 days. That averages out with people that stay 90. So you think about that. A lot of people do stay the 90 days, and quite a few are just there for a very urgent, immediate need.
And do you do any type of, do you gather any data regarding when people leave, what it is, why it is they're leaving? Like if they're not following the rules and you kick them out, that's obvious, and you could code that. But if someone has now found housing, or they have a relative that's taken them in, do you have any statistics on anything like that?
Absolutely. Because we receive HUD funding, we are required to utilize the Homeless Management Inventory System. It's a database, and they track all of those numbers. They track why people leave, how long they stay, what their condition was beforehand. So I'm not good at getting that data, that's not my job, but I could find out those answers in just a very short period of time.
How do they get the data?
Pardon?
How do they get the data?
We put it in. Aid for Friends, when somebody does an intake, they sit down with us, we get their information and their history, and we get how much if they're making any money or if they're no income. We get that whole spectrum for the entire household. So we put it into a database.
And can I surmise then that when people leave, you're also entering data, this person left for this reason?
You bet.
Okay,
Absolutely. All the way through.
okay.
All right, cool. So, we have some other programs. We have permanent supportive housing, we have homeless prevention, rapid rehousing, and those statistics are also on your annual report. We have some community services that are called, one's Region 5 Access Point. HUD requires that anyone getting HUD financial assistance be first assessed for needs to make sure they qualify. So rather than having them stop at 7 different places, now they come to Aid for Friends, we do the assessment, and then we communicate those needs with our partners. And there's a case conferencing once a month to do that. Bannock County provides housing assistance funding, and I'm so grateful for that. That fills a gap when they don't qualify quite for HUD. Maybe they make a little too much money, or maybe it's another reason that they don't qualify. We can help people with that funding. And then we also serve as the clearinghouse for the Portneuf Valley Interfaith Fellowship. How much time?
I'll give you 3 more minutes.
I want you to just go real quickly to the last page and look at our values. I would talk to you about the budget, which I think would take another 3 or 4 minutes. But we'll wait. I just want to share this. Our staff created these values, and I think it's important to know that that's what we present to our community, and that's what we hold as our standards. That homelessness does not define a person's character or ability. It is not a permanent condition unless it's chosen as a lifestyle. And some people prefer to remain homeless, and we allow them that. But for most people, it's a temporary thing. Providing services not only assists the individual or family, but also improves the community by lessening the impact that homelessness generates. Each person deserves to be treated with courtesy and respect in an atmosphere free from threat or neglect. An efficient management of human and financial resources is essential to produce quality services to the most people. Our budget is so tight, and I was talking with others about that. We've doubled with a new shelter. It's costing twice as much, and it's still under $210,000 a year to run that shelter open 365 days with coverage, with staffing, 24 hours a day. So we're doing a great job managing money, but with the larger facility, we know that it's going to take more money. So we appreciate the fact in our partnership, especially with Bannock County. You guys have, that relationship has been invaluable over the years. Okay, 3 minutes is up.
Bottom line,
More money.
what's your ask? What's
What?
your ask?
What is my ask?
You have 30,000 is what we give last year,
Yep,
and then we give you the house
yep,
a couple of years back.
yep.
What is your ask this year?
I would like to see 50,000 as a nonprofit.
I can guarantee you that's not gonna happen.
Okay, what do you want?
Guarantee you.
Okay, how about?
We are holding people pretty much to last year's budget. That's
Okay.
what the county, that's what we've asked every one of our departments,
Okay,
every one of them. And so as we go through, we're just starting the budget process.
okay.
And as we look at it,
We're giving twice the services. That's why I think an increase is not unreasonable. And 50,000 I know is an amount that's been given to other organizations. So that's why I threw it out there. Ernie, I thought we were negotiating. I'm a good negotiator.
Boy, I'm not. I'm straightforward. This is what it is.
You started. You said, what did you throw it out?
You ever
So I
watch that
did.
show?
Well,
What is it?
I would hope you would.
Fifth
consider-
Element?
Oh, yeah.
What?
The Fifth Element? When they send in, what's his name? To negotiate, and he just shoots the guy in the head, and anybody else want to negotiate? I mean, that's just plain how it was.
Watching you guys, you
That's so
Can you believe you just said that?
No, I'm just saying, I'm not a good negotiator.
Did you guys want to keep your appointment?
Woo! Anyway, it would be lovely to have more. We're offering more. We will be loosening our restrictions. I want to do it so that I can continue to provide quality services, because a shelter without case management is nothing more than a flop house. And we don't want that. We want that structure. We need to help people get back on their feet.
Bruce Willis.
That's right.
And he was good. Okay, so, all right.
All right.
That's my thing I hope you consider.
Thank you. We'll take it under advisement as we go
All
through the
right.
whole budget
right.
process.
And I would just add, as you're taking off here, I did tour your facility, as you know, recently. It was
Yes.
very impressive, so
Yes,
thank you for the work you do, and thank you for coming in.
thank you. It's something that will keep with our community for the next 20, 30 years, you know, and it gives us space if we need more space. I'm so pleased with that facility.
Thank you.
And that partnership, again, is invaluable. All right,
All right, thank you very much.
okay, thank you.
They're really cute, Dad. I was just admiring your, this is so cute.
Well, thank you. And it's easy, so when you open it up, you can just show
I knew it was cute, and then I saw it open, and I was like, oh, and functional.
and functional. Sorry, this is important. This is,
That's all right. They just started in their time.
thank you. And anyone else that would like to take another tour, I don't know if Jeff has ever seen it.
I don't know either.
I don't know. I know you have, because you were there on opening day
Yeah.
when we did the ribbon cutting. And thank you, John, for taking the time. Always, thank you.
Yep. Likewise.
Could I ever have a tour?
Would you like a
I would
tour?
love a tour.
Oh,
Can we call you sometime and get a tour?
excuse me,
Sorry.
this is
We'll
not
call
on
you,
their
though.
turn.
We can call you.
I'll give you my card, and I would love to give a tour.
I'd love to come.
Thank you.
I've never been through a tour, and we have a lot of times that we're trying to help families understand what that might look like, and so it'll
And
help
you
us
need
give
to
more
see it.
information.
Without seeing
Yeah.
it, you're just talking blind.
Yeah.
Please, and you are,
I'm Cassidy with Bright Tomorrows.
please,
Yeah. Thank you.
just give me a call.
You got it.
And this is for networking. See you guys.
See you later.
Thank you.
Appreciate you.
Hello, welcome.
Hey
there.
Thank
Please introduce yourselves for the record and
Hi, I am Cassidy Roski. I am the program director at Bright Tomorrows. Be transitioning in the next month to the executive director position, for the record.
And I'm Whitney Harris. I am currently the clinical and financial director at Bright Tomorrows, and I am transitioning kind of mostly out of Bright Tomorrows. So I will be continuing to do forensic interviews for a while here, but I'm going to try and do some work from home so I can be more available with my family. So we got some changes.
I was
going
glad
on.
you was coming to see us today. I
Yeah.
thought you'd already be gone.
Nope, not yet.
Oh,
We're hanging on.
Well, I thought I'll blame you at all.
Tight.
All right, just tell us a little bit about what's going on and then
do we need
what
any
is your-
background about what Bright Tomorrows does? Is everybody familiar with that already? Would background be
A
helpful?
little bit of background would
Okay.
help, but I wouldn't do too much.
So, as a child advocacy center, we are the agency in Bannock County that provides forensic interviews of children when they make a disclosure of abuse. So, our primary population is children who've been sexually abused. Rather than having kids talk to law enforcement or to health and welfare about what happened, they come to Bright Tomorrows and talk with one of us about what happened in a room that feels safe, is child-friendly, is really designed for the children to feel as comfortable as possible in talking about hard things. A really key component is that while the children are talking, their caregiver is also receiving support. So they meet with an advocate who is answering questions, talking about ways they can begin to support their child's healing, how to respond to any behaviors their child might be having, or if kiddo is blaming themselves, things that they can do because parents are like at a loss and their world is upside down. So really wanting to provide support and safety in that moment of uncertainty and fear, depending on the circumstances of the abuse. So we do that, and then also we provide counseling services for sexual abuse, child sexual abuse victims after that to conduct, the healing process and help the parent become that support person for the child, and working on reducing trauma symptoms and things like that. So we work alongside the Bannock County multidisciplinary team. So that is comprised of the law enforcement agencies in our county, Pocatello Police, Chubbuck Police, Bannock County Sheriff's Office, the prosecutors from Bannock County, the medical response to do the child sexual assault exams, and who am I forgetting? Oh, the Department of Health and Welfare. We all meet. We met this morning for 2 hours and go through every case to be sure that we are not missing anything, that we can provide what each case needs from different agencies. We can get kind of all the different brains on a case and make sure we're doing the best job possible. And the prosecutor, our current prosecutor, is incredible and is able to take that information and then decide what they're going to do with the case. So that's what we do in a long nutshell.
Very good.
And if you want to take a tour,
Come on
it-
over.
It is an amazing facility
Mhm.
and what's there. And they had an open house here a month ago.
Yeah.
And there was notes there from some of the kids.
Yeah.
And I went, touch your heart.
Yeah.
And then these ladies and their staff. I can't say enough.
Oh,
I
thank
mean,
you.
they are amazing.
Thank you. Yeah, thanks. So,
And if you don't have time for a tour, on our website, we have kind of a video tour too, so.
I do have time for a tour, so we'll talk about that after.
Awesome.
awesome.
That's wonderful.
Yes. So,
So, if we just talk about budget, we moved you up last year. We went to 85.
Yes.
What's your ask this year?
I think we would ask to just continue at that support level right now. We really appreciate the increase from last year. We have seen a big decline in the federal funding and the grants that we receive that support our program, so we are very appreciative of the continued and the increase in support from the county. So we're, kind of operating conservatively right now, and our board of directors has a long history of being very, I think, responsible and conservative and wanting to really make sure our program is sustainable. And even when we are dealing with funding cuts and those kinds of things. And so far, I think that has been manageable, but we are not out of the woods with that. That's going to continue for at least a couple more years where we will continue to see a decline in federal funding and support, which is a really big part of our budget. But yeah, we are appreciative with what we've got right now. And so I think we were just talking as we were coming in about the ask that we would have is support for the prosecutor's office. These cases are really important, and they're kind of the I don't know how to put it. They're really like kind of the top of the triangle for our team. So when we have a good prosecutor in there working on these cases, it just trickles all the way down through our team, and we see the best case outcomes, the most really vibrancy in our team members, and everybody is performing so much better when we have a prosecutor that is, it's almost like this relay race where everybody's doing their part of the job and doing the investigation and the forensic interview and all of these different pieces that come together, and then the last person, that prosecutor, we've in the past seen a lot of people kind of drop the ball at the end there, and it's really discouraging when everybody's put all of this hard work into these cases and there's children that are involved and being victimized. And so having a really great prosecutor in there has been wonderful. I know, so Erin Tognetti and Zoe Lagas are the prosecutors that we're working with most directly right now, and they're wonderful. I know Erin is looking at maybe making some changes, which I think would be wonderful too. She's incredible, but making sure that there's continued support for that office, and I think those two in particular are swamped, and I think that's been hard. I don't think they have enough support for those positions, and so I don't know if there's I know they've had a hard time hiring people, but
that's been a challenge.
Yeah.
And we've worked with Steve and his staff.
Yeah.
Trying to
so I really
increase
think
and improve.
Mm-hmm. That's kind of the thing for us right now that would be, in the big picture, the most impactful to our cases and to continuing to have a really well-functioning multidisciplinary team. So,
and now that they've come in and raised that bar, like what that looks like for prosecuting these child abuse cases, I'm like, no, how do we keep that bar up there? How do we not let that bar fall back down again? Because it's, like you said, it's been such an amazing thing to watch as our team is like, wait, you looked at that picture I took, you read that report I wrote, all the legwork that's going into these cases is being used, and it's just, you can see people sitting taller and working harder. So,
and getting these convictions that have been unheard of in this neck of the woods. I mean, it's really incredible that we've been having some of these offenders getting 25 and 35-year sentences. It's incredible. So
yeah.
And this is exactly why we give them an increase last year. Mm-hmm. Because you're not coming in here, you're not being selfish, you're asking for help, for somebody else to help you do your job better, and to help the victims. That's a tough part.
Yeah, they're the ones that pay the price when there can't be something at that end. And not that we ever want victims' healing to hinge on prosecution, because that's not helpful, and we start that from the very beginning. Whether or not this goes through prosecution, we have now some ability to heal and to do some things. But when that does happen and we can protect other children from being hurt, that's the key.
And getting some of these really scary people put away where they belong, and having kids not be re-traumatized by the system is really important. Yeah.
Who are some of the other entities that you get funding from?
So the Idaho Council on Domestic Violence and Victim Assistance, we receive federal VOCA funding through them, through a grant that we receive through them, and that's a big funding source for us. That's a big part of what where we receive our funding. That's what's been getting cut. So we were we'll turn in our upcoming grant cycle. Grant is due tomorrow, so that's and it's a pretty lengthy application, but from this last grant cycle, we received about $150,000. Prior to that, it was $230,000 a year ahead of that. And so when I'm talking significant cuts, I mean, it's pretty drastic. So, and like I say, is going to continue. And that's nationwide. There's just cuts in that funding. But that's a big one. We receive a grant from United Way. We got about just under $30,000 from them this year, which was an increase from what we had the year before, so that was helpful. We bill for services when we're able to, so we work with crime victims compensation, Idaho Medicaid, private insurances. So when we're able to bill for forensic interviews and counseling services, we do, but we also never turn a family away for an inability to pay. We don't want families to have to pay out of pocket for any of the services that they receive. So, you know, that's been something we've been really committed to for a long time, is that there's not any sort of financial burden on families, but when we're able to bill, we do, because we want to really diversify our funding and make sure that we're, you know, staying sustainable. We do fundraising. We have a big fundraiser in April with Child Abuse Awareness Month. And
That's tied to the open house that Ernie was
yeah,
speaking of.
yeah, and so that's corporate sponsorships, and we do a raffle, and then we also have started another.
John likes raffles, sorry. But he's lucky too, he wins.
Oh,
I like him so much.
Yes.
Any other, so what percentage of the kiddos that you see are from Bannock County? And and outside of Bannock County?
Yes, I would have to say the percentage that we see from within Bannock County is probably 70% of our cases, just kind of thinking through my stats that I gather. Bingham County is the other county that we see most of the children from, and they contribute as well. They just recently, I mean, in the last probably 2-3 years, started contributing, and then they really increased their contribution last year, which was really helpful. We don't have any, it's called an MOU, or an interagency agreement, with Bingham County or Power County or the other southern counties, only with Bannock County. But Bingham County was like, wait, what? Yes, we'll contribute. And then, so that's been amazing and really helpful. And it has allowed us to then, you know, give them more availability for services, because for a while we were seeing a lot of their kids, but we had to say, we got to protect some spaces for our own county. So that we're not having our own people waiting for so long in Bingham County. And so we're trying to make sure that we have, you know, services for everyone, but also really protecting our home county. So there's being seen with priority.
That's what I was curious
Yeah,
about.
yep, Bingham County, yes. Power County we'd love to see, but we have not. And really, I mean, the number of cases that come through, they kind of go in spurts, but I'd say maybe 10 a year, 10 to 15 a year. So it's not a huge influx, but.
And we're always kind of walking a tightrope with some of those smaller counties of, if we start asking for funding and we don't have that agreement, then are they just going to say, well, we'll interview our own kids and then do more damage that way? So that's always like something in the balance where we're like, oh, we want these kids to help.
I was just curious.
Yeah. Yep. But that's been, I mean, the thing, and with Bingham County, I think that the detective that was working these cases for a long time was like, I can do my own interviews, and then was kind of forced to come to Bright Tomorrows, and then after a couple of years was like, oh boy, I see the value in having this like full system response, and then became our biggest supporter and made that donation happen. I mean, really, truly. So,
Okay,
yes.
perfect.
What else?
Any other questions? Okay, like I said, we're looking at the budgets. I don't see anything going lower.
Great.
But
Thanks.
if there's any funds available, this is one group that
This is one group that's always.
I back 150%.
Thank you.
Thank you so much. We appreciate it.
It just,
Well, one thing I always think about too is that, and we have kind of a handout on it, but when you think about the cost of intervening and providing services to kids at this age when they are traumatized and gone through something, and being able to deal with that up front, long term, you're going to save a lot of money from substance abuse, homelessness, all of these things. When these kids don't receive the treatment that they need, they grow up to be individuals who really, really struggle and have a hard time contributing to society. And so that's a big driving force for us too, is if we can just nip it in the bud when bad things happen. We really hope, and the research shows, that we can save a lot of negative outcomes years later. I don't know if you guys have heard of like the ACEs study, adverse childhood experiences, and the negative. It's not even just behavioral and occupational and those kinds of things, but it's health outcomes. People have more heart disease, they have more diabetes when they have experienced childhood trauma that's gone untreated, they have shorter life expectancy. So all these things, I mean, it really blows up over time, and we really just want to provide those services when kids are young so they can kind of get back to normal life and hopefully have healthy, happy adulthoods. So it saves a lot of money in the long run, getting kids just the help they need when they're young. So.
Okay, well, thank you very much.
Come by for a tour, call us,
Yeah.
set something up. We'd love to have you. I know Ernie will come hopefully to board meeting sometimes. Are you busy or something, Ernie? What?
I'm not-
I can't imagine.
You have one next week, right?
Yep, Monday at noon.
And I'm flying out Monday,
Where are you going?
going to Moscow to a conference. And
Oh,
then I have a
somewhere
Board of
fun.
Health conference
Oh.
later that week in Coeur d'Alene.
We'll have more
You
board
are
meetings,
busy,
don't
guy.
worry.
And I apologize.
No, it's
That's
fine.
okay. That's okay.
But,
This
No,
commissioner
we're happy when
position,
you
we
make it.
actually decided, maybe within the last year sometime, that rather than having that take up like a board member position, we want to have that be something that like when you can come, awesome, and we have you there, but that you're also not tied to the same, two absences and you're out of here, because we want to keep you. So,
Well,
we made exceptions for you.
And we know you're very busy. You have a
Busy.
very busy schedule
So
with lots of
busy.
things on your plate,
So-
so
Yeah.
that's.
Anyway,
We
thank
appreciate
you.
your support.
Thank you very, very much.
Yes, thank
Appreciate
you.
all you do.
Thanks, thanks,
We
you too.
appreciate you too. Thank you so much.
And with
And you
that,
probably
we-
have cute purses too, I don't know.